Well, welcome back. Local on 2 is celebrating Wellness Wednesdays and helping you feel better by addressing a variety of topics. Hormone changes across a woman's lifespan brings unwanted changes in our bodies. One treatment option, hormone replacement therapy.
Yes, but there's still confusion about its effectiveness and safety and whether hormone therapy is linked to an increased risk of other illnesses. So Sylvia Castaneda sat down with doctors from Inspire Medical Wellness in Mount Juliet and Avexius Health Solutions to break it all down.
Many women avoid hormone replacement therapy later in life because of fears surrounding breast cancer. That is why I am so happy to have back with us Dr. Jason Burchard, who is the owner of Inspire Medical Wellness in Mount Juliet, and Dr. Terry Denai, who is the founder of Avexius Health Solutions. They're back to teach us more. Welcome back.
Yeah,
glad to be here.
Glad to be here.
Okay, Dr. Denai, let's talk about the background here. How and why have we become so afraid of hormone replacement therapy and the connections that we feel increases our risk for breast cancer? Where did that come from?
It came from the Women's Health Initiative trial, and that was the largest trial to date on women's health and hormones. And really what the intention of the trial was to prove what doctors had been seeing in their offices, and that estrogen was very beneficial to prevent cardiovascular disease. But unfortunately what happened, there were two arms of the trial. One was a synthetic estrogen and one was a synthetic estrogen and progestin, not progesterone. And after about 2002, about 4 years into the trial, they noticed that the women in the progestin arm of the trial had much higher rates of breast cancer and heart disease and Alzheimer's disease, but primarily breast cancer, and so they stopped the trial early. But what happened, unfortunately, is they took the information from that arm of the trial and they applied it to all hormones. And so then this misinformation came out in the media that hormones cause breast cancer, you need to stop your hormones. Doctors quit prescribing, women were dumping them down the toilets, and fast forward about 3 or 4 months after that, and women were not very happy without their hormones. But to this day we continue to unravel from this misinformation.
Dr. Burchard, let me go to you. What potential risks does a woman face when we talk about avoiding hormone replacement therapy due to that fear factor?
Well, first of all, and to Dr. Terry's point, they increase their risk for breast cancer, along with other forms of cancer, and they also increase their risk for things like dementia and Alzheimer's and heart attack and stroke and bone loss, on top of the risk factors of becoming a shell of their former selves because of the symptoms that come along with hormones that are deficient. The chronic fatigue, the brain fog, the weight gain, the anxiety, the depression, the pain. There's just, and the list and the symptoms just go on and on.
Then Dr. Denai, tell me this. How do you navigate then replacing hormones for women who have either a family history of this, have a personal history of this?
Well, a family history isn't a reason to avoid hormones. Obviously, you get your mammograms, you stay up to date on your exams, and you do all the right things and eat well and all the things that you need to prevent. But the problem is so many women that have had a personal history of breast cancer have been told you can never do hormones again. Now, Dr. Burchard said a really important thing is that now we know estrogen actually decreases breast cancer risk and decreases death from breast cancer, but it's not standard of care to give a woman estrogen after she's been diagnosed with breast cancer, at least for 5 years or more. But testosterone is a powerful hormone that not only can help mitigate all of her symptoms, but it's also been shown in many, many clinical studies to be preventative for breast cancer. So women don't have to suffer needlessly even with that breast cancer diagnosis, because testosterone is a powerful, safe hormone for women.
Then doctors, what last message would you like to send out there to women who maybe are considering this or maybe have been afraid because of their history with breast cancer? What's the last message?
I think a message of hope, a message of encouragement, because as she just stated, women do not need to fear. They do not need to live with all these symptoms just completely unnecessarily. They need to be, if they're working still with an oncologist, they need to be asking these questions. They need to be having these conversations. They need to find, clinics like we have in Mount Juliet at Inspire, or other clinics that are partnered with Avexius Health Solutions that have been trained to know how to navigate through proper hormone optimization,
That's right.
even once again a person's had once they're post-cancer.
Yep, I agree 100% with all that. I don't think I would add anything to that, other than follow your gut, follow your intuition, and if you aren't really getting because you can't blame your doctors and your oncologists because they just maybe don't know. And so just continue to research, continue to get the right information, and continue to search for a clinician that understands and will help you.
Doctors, thank you so much for coming on and educating us and helping us disseminate all this information that's out there. We so greatly appreciate it.
Thank you.
I'm going to send it back to you.
All right, thank you, Sylvia. To learn more about hormone replacement therapy for men or women, or to make an appointment, visit inspiremedicalsolutions.com, or you can visit avexius.com and then click Find a Provider.